You've been told your blood pressure is too high, so your doctor handed you a prescription, maybe two, maybe three by now, and sent you on your way with instructions to take them every day for the rest of your life. And if you're over 60, chances are nobody sat you down and asked a single important question. They didn't ask why your pressure went up in the first place. They didn't ask what changed in your body as you aged that suddenly made the numbers climb. And they certainly didn't tell you that the blood pressure target they're aiming for might actually be wrong for someone your age. They just wrote the prescription, checked the box, and moved on to the next patient. And here's what makes me frustrated on your behalf. That approach isn't medicine. That's protocol. And protocol doesn't have time to explain that your 65-year-old arteries don't work the same way they did at 35, that the one-size-fits-all blood pressure goal printed on the chart might be doing you more harm than good, or that there are specific measurable reasons your pressure climbed that have nothing to do with salt or stress and everything to do with changes happening quietly inside your blood vessels that nobody explained. But before you feel powerless, let me give you the hope that matters most. Your blood pressure at 60 is not a life sentence. It's a signal. And when you understand what that signal is actually telling you, when you know what's happening inside your arteries and why, you can work with your body instead of just drugging it into submission. I've watched people in their 60s and 70s bring their numbers down, reduce their medications, and feel better than they have in years, not by adding more pills, but by addressing the real causes nobody took the time to teach them. So this is not a video about fear or resignation. This is about giving you back control and understanding. In my years of practice, I've sat with countless patients over 60 who were on 3, 4, sometimes 5 blood pressure medications, still not hitting goal, feeling tired and dizzy, and convinced their body was just broken. And when I walked back through what actually changed as they aged, what their blood vessels needed that they weren't getting, and what the medications were doing versus what their body actually required, almost every single one of them realized the same thing. They'd been treating a number on a screen without ever understanding the system underneath it. The truth your doctor doesn't have time to tell you, not because they don't care, but because the system doesn't pay them to spend 40 minutes explaining physiology, is that high blood pressure after 60 is almost never about one thing. It's about 4 or 5 things that stack together, and most of them are fixable without a single new prescription. Before I get into it, do me a quick favor. If you want videos that actually explain how your body works instead of just handing you another pill, hit subscribe, give this a like, and leave me a comment telling me your age and how many blood pressure medications you're currently taking. I read everyone, and those numbers tell me exactly what's not being explained in your appointments. All right, let's get into it. But first, you need to understand something that changes everything. Your blood pressure is not a disease. It's a measurement. It tells you how hard your heart is working to push blood through your arteries. And the reason that number goes up as you age has almost nothing to do with your heart getting weaker. It has everything to do with your arteries getting stiffer. Here's what's actually happening inside you. When you're young, your arteries are flexible. Every time your heart beats and sends a wave of blood forward, the artery walls stretch a little to absorb that pressure, like a garden hose with some give in it. That stretch keeps the pressure smooth and manageable. But as you age, especially after 60, the walls of your arteries start to stiffen. They lose that elastic stretch. Now when your heart pushes blood forward, instead of the artery wall absorbing the pressure just climbs higher, like trying to push water through a rigid metal pipe instead of a flexible hose. The heart pushes harder to move the same amount of blood, and the pressure reading on the cuff goes up. This stiffening has a name. It's called arteriosclerosis, and it's different from the cholesterol plaque buildup everyone talks about. This is structural. The artery wall itself becomes less flexible because of changes in the proteins that give it strength, because of calcium deposits that shouldn't be there, because of inflammation that thickens the wall, and because of missing nutrients that used to keep the wall supple. And here's the part that should make you ask hard questions of the system. Almost none of that is addressed by blood pressure medication. The pills lower the number on the screen by forcing your heart to pump less hard or by dilating the vessels artificially, but they don't restore flexibility. They don't fix the stiffness. They override the symptom without touching the cause. Now let me show you the 4 real reasons your blood pressure went up after 60. Because once you see them, everything I'm about to tell you will make perfect sense. The first reason is magnesium deficiency, and this is the single most overlooked cause of high blood pressure in older adults. Magnesium is the mineral that keeps your artery walls relaxed and flexible. It works like a natural calcium blocker, And when your magnesium level drops, calcium floods into the smooth muscle cells lining your artery walls. The muscle contracts, the artery tightens, and your pressure climbs. After 60, you lose magnesium faster than younger people for 3 reasons. Your kidneys don't hold on to it as well, your gut doesn't absorb it as efficiently, and many of the medications older adults take, especially diuretics and acid-blocking drugs, flush magnesium out of your system every single day. Studies have shown that low magnesium is present in the majority of people with high blood pressure, and supplementing it, done correctly, can drop systolic pressure by 10 to 15 points in a matter of weeks. That's the same effect as adding a medication, except you're fixing a deficiency instead of creating a dependence. But almost no doctor checks your magnesium level because the standard blood test misses it. Magnesium lives inside your cells, not floating in your blood, so a normal blood test tells you almost nothing. The better test is called RBC magnesium or ionized magnesium, and most people over 60 have never had it done. The second reason is something called endothelial dysfunction, and you need to understand this because it's the hidden switch that controls whether your blood vessels stay open or clamp down. The endothelium is that delicate inner lining inside every artery we talked about before. When it's healthy, it produces a molecule called nitric oxide, which tells the artery to relax and stay open. Think of nitric oxide as the body's natural blood pressure medicine. It keeps vessels flexible, it prevents clots, and it allows blood to flow smoothly with less force. But after 60, especially if you've spent years eating foods that spike your blood sugar, if you've been under chronic stress, if you're not moving your body regularly, or if you're deficient in certain nutrients, your endothelium stops making enough nitric oxide. The signal to relax gets weaker, the arteries stay partially constricted, and your pressure climbs. This isn't something a pill fixes long term. This is something that requires you to support the system, and there are specific foods and behaviors that restore nitric oxide production naturally. But nobody tells you that, because there's no prescription pad for beets and walking. The third reason is insulin resistance, and this one ties directly back to breakfast and every meal after it. When you spend years riding the blood sugar roller coaster, eating refined carbs, spiking your glucose and your insulin over and over, your cells eventually stop responding to insulin the way they should. That's insulin resistance. And here's what most people don't realize. Insulin resistance doesn't just affect your blood sugar, it directly damages your blood vessels. High insulin levels in your blood cause your kidneys to hold on to sodium and water, which increases blood volume and pushes your pressure up. Insulin also stimulates your sympathetic nervous system, the fight-or-flight system, which keeps your vessels constricted and your heart rate elevated. And insulin promotes inflammation and stiffness in the artery walls themselves. So if your blood pressure went up around the same time your waistline expanded, your energy dropped, and your doctor started mentioning prediabetes, those things are connected. You're not dealing with 3 separate problems. You're dealing with one upstream problem, insulin resistance, that's breaking multiple systems. And the standard treatment completely misses it, because lowering the blood pressure number with a pill does nothing to fix the insulin problem driving it. The fourth reason is chronic dehydration. And this one is so simple it sounds almost insulting, but it's real and it's measurable. After 60, your sense of thirst fades. You don't feel thirsty the way you did when you were younger, so you don't drink enough, and you walk around mildly dehydrated most of the time without realizing it. When you're dehydrated, your blood volume drops, and your body compensates by constricting your blood vessels to keep your pressure up enough to supply your brain and organs. It's a survival mechanism, but it looks like high blood pressure on the cuff. On top of that, many older adults are taking a diuretic, a water pill, which makes the dehydration worse. You're losing water through the medication, you're not replacing it because you don't feel thirsty, and your body responds by clamping down on your vessels even harder. I've seen blood pressure drop 10 points just by having someone drink 6 to 8 glasses of water a day consistently for 2 weeks. No new medication, just water. But that conversation takes time, and time is the one thing the system doesn't give your doctor. Now, here's where all of this comes together, and this is the part your doctor won't tell you. Not because it's a secret, but because it's not part of the protocol. The blood pressure target you're being treated to, the goal of getting you under 130/80 or even 120/80 may not be right for you. And in some cases, pushing your pressure that low with medications after age 65 or 70 can actually cause more harm than benefit. Let me explain why. There's a massive study that came out several years ago called the SPRINT trial, and it's the one that convinced many doctors to push for lower and lower blood pressure targets in older adults. The study showed that getting pressure below 120 reduced heart attacks and strokes compared to keeping it below 140. That sounds great on paper. But here's what didn't make the headlines. The people in that study who were pushed to very low targets had significantly higher rates of fainting, falls, kidney injury, and dangerously low blood pressure when standing up. And for older adults, a fall is not a minor event. A fall can mean a broken hip, loss of independence, and a downward spiral that changes everything. On top of that, your brain needs a certain amount of pressure to push blood uphill against gravity, especially when you stand. If your pressure is dropped too low with medication, blood flow to your brain decreases, particularly when you stand up quickly. And that's why so many older adults on multiple blood pressure drugs feel dizzy, foggy, and unsteady. They're being treated to a number that looks good on paper, but leaves them functionally worse. There's even research suggesting that in people over 75, particularly those who are frail, slightly higher blood pressure, in the 135 to 145 range, is actually associated with better outcomes and longer life than aggressively low pressure. The sweet spot shifts as you age, but the guidelines often don't, because guidelines are built for populations, not individuals. So here's the question nobody asks you. How do you feel? Are you dizzy? Are you exhausted? Are you steady on your feet? Or are you sharp, energetic, and strong? Because those answers matter more than whether the top number is 128 or 134, and if your doctor is adding a fourth medication to chase a number while you're feeling worse, that's a conversation worth having. Let me tell you about a patient who lived exactly this. I'll call him Richard. He was 68 when I met him, retired from teaching, active, still doing woodworking in his garage most afternoons. His blood pressure had crept up into the 140s over 190s in his early 60s, and his doctor started him on medication. Reasonable. But over the next few years, as the guidelines tightened and the goal shifted lower, he was put on a second medication, then a third, then a fourth. His pressure came down to 118 over 76. Perfect on paper. But Richard felt terrible. He was exhausted all the time. He felt lightheaded every time he stood up. He'd actually fallen twice in 6 months, once in his garage and once getting out of bed at night, and he was terrified it was going to happen again. When I met him, we did something simple. We checked his blood pressure sitting, and then we checked it again 1 minute after he stood up. Sitting, it was 118 over 78, right on target. Standing, it dropped to 92 over 60. That's called orthostatic hypotension, and it explained everything. His pressure was being pushed so low by the medications that his brain wasn't getting enough flow when he stood, and his body was screaming at him with dizziness and falls, but nobody had checked. Working closely with his own doctor, we carefully reduced one of his medications and shifted his focus to the upstream causes. We added magnesium glycinate, 400 milligrams a day. We fixed his breakfast, moving him off cereal and onto eggs and vegetables to stabilize his insulin. We got him drinking more water, 8 full glasses a day. And we had him start a simple walking routine, 20 minutes most mornings, which has been shown in study after study to improve endothelial function and lower blood pressure naturally. Within a month, his standing pressure stabilized. Within 3 months, his fatigue lifted. He felt steady again. His pressure sitting was in the 130 to 135 range, slightly higher than the aggressive goal, but he felt strong, clear, and safe. 2 years later, he's still on 2 medications instead of 4. He hasn't fallen once, and he's back to working in his garage without fear. We didn't chase a number. We treated the person. So let me make this as clear as I can. If you're over 60 and your blood pressure is high, you need to know why before you just add another pill. And the why is almost always some combination of magnesium deficiency, endothelial dysfunction, insulin resistance, and dehydration. Those 4 things are fixable. They don't require a lifetime of side effects. They require understanding and consistency. Now let me give you the exact framework I use with every patient over 60 who wants to lower their pressure naturally while working safely with their doctor. First, get your magnesium level checked properly. Ask for RBC magnesium, not serum magnesium. If your doctor won't order it, ask why, because it's a standard test and it matters. If it's low or even low normal, add magnesium glycinate or magnesium threonate, 300 to 400 milligrams a day, taken in the evening. These forms are well absorbed and gentle on the gut. Avoid magnesium oxide, which is cheap and poorly absorbed. Within a few weeks, most people notice their pressure trending down and their sleep improving because magnesium also calms your nervous system. Second, support your nitric oxide production because this is your body's natural blood pressure control system. The most effective and researched way to do this is with dietary nitrates from vegetables. Beets, arugula, spinach, and celery are all rich in nitrates that your body converts into nitric oxide. A small glass of beet juice or a serving of greens daily has been shown in multiple studies to lower blood pressure measurably within weeks. You can also support this with movement. Just 20 to 30 minutes of walking most days increases nitric oxide production and improves how your vessels respond. It's free, it's safe, and it works. Third, stabilize your insulin by fixing what you eat, particularly at breakfast. If you're starting your day with cereal, juice, toast, or pastries, you're spiking your blood sugar and your insulin every single morning, and that's driving your pressure up from the inside. Move to a breakfast built on protein and fat. Eggs, avocado, vegetables, full-fat yogurt, nuts. No sugar spike means lower insulin, less sodium retention, less vascular inflammation, and lower pressure. I've seen systolic pressure drop 15 points just from changing breakfast consistently over 2 months. Fourth, drink water intentionally because your body won't remind you anymore. 6 to 8 glasses a day is the goal. Set reminders if you need to. Keep a bottle on the counter. Drink a full glass first thing in the morning and another before each meal. If you're on a diuretic, this becomes even more important because that medication is pulling water out and your body needs you to replace it. And fifth, have an honest conversation with your doctor about your target and how you feel. If you're on 3 or more medications, if you're feeling dizzy or weak, if you've had any falls or near falls, that's not normal aging. That's overtreatment. Ask your doctor to check your standing blood pressure and to consider whether a slightly higher target might be safer and more appropriate for you. Bring research if you need to. Print out information on the SPRINT trial's side effects in older adults. Be your own advocate because no one else will. Now let me tie this all together, because this is the part that decides whether the next 10 years of your life are defined by energy and independence or by limitations and fear. Your blood pressure is a signal, not a life sentence. It's telling you that your arteries need support, that your body is missing something, that a system upstream is struggling. Covering that signal with medications without addressing the cause is like putting tape over a warning light on your dashboard. The light stops blinking, but the engine is still failing. The medical system isn't designed to fix you. It's designed to manage you. Management is profitable. Fixing the root cause takes time, education, and empowerment, and none of those generate revenue. So the system gives you a pill, checks the box, and moves on. But you don't have to accept that. You can ask better questions. You can address the real causes, and you can work with your doctor, not against them, to find the approach that makes you feel strong instead of just making a number look good. Before I give you your action steps, let me say this clearly. Do not stop your blood pressure medication on your own. If your pressure is high and uncontrolled, that's dangerous. The goal is to bring it down safely using the tools I've given you, and as it improves, to work with your doctor to reduce your medications gradually under supervision. Stopping suddenly can cause a rebound spike that's worse than where you started. Do this smartly, not recklessly. So here's exactly what to do, starting today. First, tomorrow, change your breakfast to protein and healthy fat. Eggs, avocado, vegetables, no cereal, no juice, no toast. That one change affects your insulin, your inflammation, and your pressure all day long. Second, this week, start drinking 8 glasses of water daily. Set a reminder on your phone every 2 hours. Third, add magnesium glycinate, 3 to 400 milligrams in the evening, and if possible, get your RBC magnesium tested to confirm you need it. Fourth, start walking 20 minutes a day most days. It doesn't have to be fast, it just has to be consistent. And fifth, schedule a conversation with your doctor specifically to review your medications, your target, and how you're feeling. Bring a list. Bring this video if it helps. Ask the hard questions. Give this 12 weeks. That's the timeline where the real changes become visible. Your pressure won't drop overnight, but it will trend down steadily as your magnesium rises, your insulin stabilizes, your vessels start producing nitric oxide again, and your body rehydrates. You're not broken. You're undersupported. And now you know how to change that. Now everything we covered today helps your blood vessels relax, and your pressure come down naturally. But there's one vitamin deficiency that's epidemic in people over 60, and it directly causes your arteries to stiffen and your blood pressure to climb, and almost nobody checks for it. I made a video that explains exactly what that vitamin is, how it works, and how to fix it safely. I'll put it right here on the screen. Go watch that one next, and I'll see you there. This is Dr. Robert Chen, looking out for you.